been on a liver transplant list at University of Pennsylvania in Philadelphia for about 10 years. I was very limited with my mobility before my transplant. I had so much swelling in my legs that I could not bend my knees. I had a hard time getting into my bed. My husband would pull me to get into the bed because I just couldn't do it by myself because nothing would bend.
She was on dialysis, swollen with 30-40 pounds of fluid, possibly even more than that, and really was not herself.
My doctor felt that I could get a transplant quicker if I came somewhere else.
One of my colleagues who was taking care of her up there noticed that she was becoming increasingly sick and was worried that she might die before she received her liver transplant in Philadelphia. He contacted me and asked me if we would see her to evaluate her to see if she could be listed in Charlotte for liver transplant because our waiting times were shorter.
My husband got an apartment and we rented furniture and we set up right across the street from the transplant clinic.
By the time Ms. Scheuer had come to us, we realized that she needed a liver transplant. There was no other type of therapy that would help her.
That was a wonderful day when I found they had a liver for me. After the surgical ICU, then I was sent to the liver floor. They transferred me over to Carolina's Rehabilitation Center. And I was very happy to get here too because I wanted to get stronger. I had no strength in my legs at all.
When Nancy first came in, she really wasn't very stable regarding her ambulation. She had difficulty moving from the bed to the chair. Her energy levels were low.
Even in the beginning, she wasn't even able to stand up from a lower surface. So we started at a higher surface and still needed assist to stand. We basically just started out working on her endurance, her activity tolerance, then started working on progressing with functional mobility. We did a lot of strengthening.
We were able to focus her on 3 hours of therapy a day. We were able to focus on her medical issues because of the liver transplant and consolidate all of the information and all the issues that she was facing to make sure she had a good outcome.
And they all encouraged me to improve. I had a drive within me too, because I wanted to get better, and I know that was part of it. And a lot of the doctors from the hospital and the doctors from the Rehabilitation Center all said that my attitude made a big difference in my recovery because I really wanted to get better.
From day one, we kind of hit it off, had a really good relationship. She was great to work with, so motivated. She had incredible family support. Her daughter was here every day.
When she first came down here, she was really, very swollen and she just looked like she was just miserable. 2 weeks later, she's already, trying to be mobile, and they can see the motivation and they can see the inspiration in her whole personality. 2 months after, and it's just incredible to see the change in her physically and her, mentally, and how inspired she is.
She worked extremely hard. Anything that we would give her, any exercises to do on her own, she and her daughter would do them every night in the room. She was very compliant with any exercises, any education, any recommendations that we made.
And by the time she left, she was walking independently. She was able to get in and out of the bed, in and out of a chair without any problems. She was able to participate in long durations of activity without any significant breaks. We anticipate that she'll return to a very normal life, able to participate in her own care, able to be independent with her mobility, and return to her prior level of functioning.
So that's our goal here, is to get the patient back to being as independent as possible.
They encouraged me and they motivated me and they made me feel that they cared about me. And it's the caring, I think, that makes the big difference. Because you can be in another place where they can try to motivate you and they can try to encourage you. But if you don't feel that they really care, you don't take it in as well. But I always felt that people cared about me here. They cared about how I could make every step of progress, and they let me know that they care, so that you have an extra motivation, because you're not only trying to do it for yourself, but you're trying to do it for them too.
Transplant is a team process. We work as a team with Carolina's Rehabilitation and with the transplant surgeon, myself, and one of my colleagues. And the team, whether it's the nurses, assistants, the doctors, the physical therapists, really try to be very friendly, not that just to patients coming from out of state, but for all patients to make them feel like they're at home.
I just have such high regard for the hospital, the rehabilitation. It's an entire package that you can move departments, you can move to a different building for the rehabilitation, but you're still part of the same family.
I think Nancy did much better because she came to Carolina's Rehabilitation and Carolina's healthcare system. Her care was comprehensive from before the transplant to the completion of the transplant and to the return of home. It's very rare that facilities can provide the appropriate medical and rehabilitation services to optimize their care and function, and Nancy's the prime example of somebody who's benefited from that.
I have a hope for the future, to do things with my husband, with my family, with my friends that I didn't have before. So I have a new life. Carolina's Rehabilitation has helped restore quality to my life.